Chronic kidney disease and transplant, a guide to the process. Hello and welcome to our guide to chronic kidney disease and kidney transplants. Chronic kidney disease, or CKD, affects millions of people around the world, and for those in the late stages of the disease, a kidney transplant can be a life-saving option. In this video, we will cover the process of receiving a kidney transplant, from evaluation to recovery. Segment 1. Evaluation. The first step in the transplant process is to undergo an evaluation. This involves meeting with a transplant team, which may include a transplant surgeon, a transplant nephrologist, a social worker, and a financial coordinator. Your medical professional should guide you through what each stage of CKD means, how it will affect your body, and the steps to take to manage the symptoms. There are 5 stages of CKD. The stages of CKD are measured by your glomerular filtration rate, or for short your GFR. Your GFR is a test used to check how well the kidneys are functioning. Your GFR specifically estimates how much blood passes through your glomeruli each minute. Within stage 1 your GFR may be above 90 milliliters a minute. In stage 2 your CKD will be considered mild, with a GFR between 60 to 89 milliliters a minute. In stage 3 your CKD is moderate with a GFR of 45 to 59 milliliters a minute. In stage 3B your CKD is moderate with a GFR of 30 to 44 milliliters a minute. At stage 4 your CKD will be considered severe with a GFR of 15 to 29 milliliters a minute. At stage 5 your CKD is considered to be at the end stage, with a GFR below 15 milliliters a minute. Once your stage of CKD is diagnosed, they will review your medical history, perform various tests, and discuss your options with you. The evaluation process helps determine if you are a good candidate for a transplant and if a living donor is available. If you do not have a living donor, you will be placed on a wait list for a deceased donor kidney. The waitlist time can vary greatly depending on factors such as blood type and the availability of organs. If you have a living donor, the transplant can be scheduled at a time that is convenient for both you and the donor. A living donor can be a family member, friend, or even a stranger who is a match. Segment 2. Surgery. Once a kidney becomes available or the living donor surgery is scheduled, the transplant surgery will take place. The surgery typically takes 3 to 4 hours and requires a hospital stay of 3 to 7 days. During this time, the medical team will monitor you closely to ensure that the kidney is functioning properly. After the transplant surgery, recovery will take several weeks. You will need to take medication to prevent your body from rejecting the new kidney, and your medical team will closely monitor your progress. You may also need to make lifestyle changes such as following a special diet and avoiding certain activities. It is important to attend all follow-up appointments and notify your medical team of any concerns or symptoms you experience. If you need more information on CKD, visit our website at kidneytree.com. Segment 3. Success rates and risks. The success rates of kidney transplants are generally high, with the transplanted kidney functioning for an average of 10 to 15 years. However, there are also risks involved, including the risk of infection, organ rejection, and the need for additional surgery. It is important to discuss the risks and benefits with your medical team and make an informed decision. In conclusion, a kidney transplant can be a life-changing and life-saving option for those with chronic kidney disease. The process involves evaluation, wait listing, living donation, surgery, and recovery. While there are risks involved, the success rates are generally high, and with proper medical care and lifestyle changes, a transplanted kidney can function for many years. If you or a loved one is considering a kidney transplant, be sure to discuss all options with your medical team and make an informed decision. Thank you for watching our guide to chronic kidney disease and transplant.